Coronavirus has literally left people across the country on edge, especially when they're being told to wear masks as safety precautions when out in public. Take a look at this video.
There ain't no rule that I gotta wear a mask. You gotta get 6 feet or a mask. It's not close.
That man harassed me for not wearing a mask. Stop it, dude.
Hey, if you don't want to got you. Tough one. You understand? Oh.
Some of these people claim they have so-called mask exemption letters, but are they legit? Joining us to help shed some light on this topic is the Chief Medical Officer for the American Lung Association, Dr. Albert Rizzo. Dr. Rizzo, these videos, of course, are extremely disturbing for everyone to watch, let alone be in them. But from a medical standpoint, should people be exempt from wearing masks in public?
Well, there are very few people that have the amount of lung disease that really would be impeded by wearing a mask. In fact, the ranting and raving that you see on these videos, that's the lung capacity of somebody who really doesn't have that much trouble wearing a mask because they have too much vocal quality and lung capacity demonstrated in their actions. So people do ask me, is it safe for me to wear a mask? And I talk through it with my patients one-on-one. And sometimes mask exemptions are given, but I personalize them. And I think many doctors go through the same process.
But there are conditions where people really do have severe lung disease, where breathing into a mask obviously is difficult, correct?
That's correct. But also that's the same group of individuals at high risk of developing complications. So many of my patients with that severe of disease, I counsel them to say, this is not where you want to be going out into public without wearing a mask. You want to have somebody else help you, a caregiver if possible, or have it delivered. You're putting yourself at more risk by going out into the public, especially if you're not wearing a mask.
So what about people who say that they're uncomfortable wearing a mask? What advice do you give them?
Yeah, that's legitimate. And it's not so much the breathing part of it, it's the anxiety, the uncomfortable feeling of something going over your mouth. And many times if I explain it to the patients, I help them reassure the fact that science is on their side. But the uncomfortable part can be mitigated by practicing in their own home, wearing a mask for 10, 15 minutes, walking around the house, getting used to having it on and convincing yourself that you can do it for the period of time you have to go out and do the errand that you have to.
But Dr. Rizzo, we are seeing and have heard people who really can wear a mask and don't have medical issues, they're going to doctor's offices and asking for letters just so they can be excused from wearing the mask.
Right, and I think that's where the physician-patient relationship has to be the key point. I mean, some physicians will give an exemption for various medical reasons, but by and large, most individuals don't need them. In fact, we were getting so many questions from doctors across the country that main organizations like the Lung Association, Thoracic Society, we put out a joint guidance saying that very few people really need it from a medical standpoint, and it's a physician-patient decision, one-on-one, that has to make that decision. I personally have not given out many. I have a practice of 15 doctors, and I've asked them several times. It's very rare for us to give out a mask exemption letter, and if we do, we personalize it. It's not a rubber stamp card that we give out.
Well, you know, Dr. Rizzo, I'm hoping that people are listening to you and what you've had to say and to realize, yes, it's uncomfortable, but there are ways you can actually get yourself adjusted to the mask, right? You have some quick tips about how to adjust yourself, right?
Right. The main thing is find something that's comfortable, desensitize yourself at home, wearing it for a period of time, so you're comfortable going out in the area and doing the errand you have to for that short period of time.
Great. Well, Dr. Rizzo, this is great advice. Thank you so much for joining us.